we just have to find, line up the circle with the pupil and use a joystick to bring it into focus. So right now I'm too far away from the patient, so it's blue. So it's a blue ring, and then over here we're too far away. So I just need to go and move in a little bit. He blinks, so it got artificially red. But if I move into green, I don't even have to be that focused or centered. I can just click go. And now the machine is taking over and taking pictures. So right now, if you look at the machine, it's moving around here, and it's taking slits at multiple depths, multiple spots across the cornea. I can do any type of sequence that I want: thin slits, thick slits, combination slits, retroillumination. This is just a quick, actually it's not quick, it's a pretty detailed thin slit evaluation from both sides. It takes about 20 seconds or so for capture. Halfway through, when the machine moved, the patient's allowed to blink. So Alex, you're doing great. We got about 5 seconds, 4, 3, 2, 1, we're done. You can sit back and relax. You did a great job.
Thanks.
So the technician then can scroll through these images to make sure that they look good. So I'm going through, and I can just go through and say, they all look good. You might say, wait a sec, these are all in focus on the cornea, but they're not in focus on the iris or anterior lens. So I can go deeper, and now it's in focus at the iris plane at the lens surface. So this patient's not dilated, so there's not a lot to see through that pupil and deeper. So I'll show you some better examples. We can do retroillumination, which is very powerful in a lot of clinical situations. And our system does that with infrared light. So you can notice that the pupil is a little bit bigger here than here, because the pupil, we weren't in complete darkness, but it was dimmer, and his pupil is a little bit bigger. So we're actually able to see more of the eye. But he's normal. He doesn't have Fuchs. He doesn't have anterior basement membrane dystrophy or a dry eye. So once we're satisfied with the images, I can just
look at the. We're just putting the same.
Okay, yeah, exactly. So he's focusing through. Now, after I go through these, I'm satisfied it's a good capture. I can just hit save and exit, and now it's loading things up to the cloud. Those images go up to the cloud. They're full 12 megapixel images, so same that you might have on your iPhone, and they go up to the cloud. They're not compressed at this current state, so it takes about 2 minutes or a minute and a half to go up to the cloud. And with a hotel Wi-Fi, it would be even faster if you had a faster service. You had Starlink or something, it'd be even better. Once they get to the cloud, they take about a minute or two to go down to any device anywhere in the world. So